So myocarditis is the inflammation of the myocardium, global enlargement of the heart, dilation of all the chambers. It's the major cause of SCD in adults, and presentation highly variable. Can include dyspnea, chest pain, fever, arrhythmias, persistent tachycardia out of proportion to the fever is characteristic. Multiple causes, if it's viral, adenovirus, Coxsackie B, paravirus, B19, HIV, HHV6, lymphocytic infiltrate with focal necrosis, highly indicative of viral myocarditis. Parasitic, Trypanosoma cruzi, Toxoplasma gondii. Bacterial, Borrelia burgdorferi, Mycoplasma pneumoniae. Toxins, carbon monoxide, black widow venom. Rheumatic fever, drugs, doxorubicin, cocaine. Autoimmune, Kawasaki disease, sarcoidosis, SLE, polymyositic dermatomyositis. Complications include sudden death, arrhythmias, heart block, dilated cardiomyopathy, heart failure, mural thrombus, and systemic emboli. Cardiac tamponade, compression of the heart by a fluid surrounding the heart. Blood effusions, decrease in cardiac output, equilibration of diastolic pressures in all four chambers. Findings, Beck triad. Beck triad is the hypotension, distended neck veins, distant heart sounds, increase in heart rate, pulses, paradoxis. ECG shows low voltage QRS, electrical alternans due to swinging of the movement of the heart in large effusion. Pulsus paradoxis, a decrease in amplitude of systolic blood pressure by more than 10 millimeters of mercury during inspiration. Seen in cardiac tamponade, asthma, obstructive sleep apnea, pericarditis, and croup. Syphilitic heart disease. Third phase, syphilis disrupts the vasa vasorum of the aorta with consequent atrophy of vessel wall and dilatation of aorta and valve ring. A Macy calcification of the aortic root, ascending aortic arch and thoracic aorta, leads to tree bark appearance of the aorta. Can also result in the aneurysm of an ascending aorta or an aortic arch, aortic insufficiency. Vasculitides, large vessel vasculitis, glant cell temporal arteritis, usually elderly females is where it's presented, unilateral headaches, temporal arteries, jaw claudication. Let's see, most commonly affects branches of the carotid artery, focal granulomatosis inflammation. Let's see, associated with polymagalia rheumatica. Treat with high doses of corticosteroids prior to temporal artery biopsy to prevent blindness. Takayusu arteritis, usually Asian females less than 40, pulseless disease, fever, night sweats, arthritis, myagles, skin nodules, ocular disturbances, granulomatosis, thickening, narrowing of the aortic arch, proximal great vessels. Treat with corticosteroids in that case as well. Well, here's your, show these. Here's A. So these are your focal granulomatosis inflammation. There it is. Here's B. which is the aortic arch, proximal great vessels narrowing. So there you go. Pecoris arteriosus, narrowing of the aortic arch and proximal great vessels. Polyarteritis nodosa, usually middle-aged men. Hepatitis B, seropositivity in 30% of the patients. Fever, weight loss, malaise, headache, gastrointestinal, abdominal pain, melena, hypertension, neurologic dysfunction, cutaneous eruptions, renal damage. Typically involves renal and visceral vessels, not pulmonary arteries. Transmural inflammation of the arterial wall. Different stages of inflammation may also coexist in different vessels. Innumerable renal microaneurysms. So they look like this. Here's C. There you go. Renal cerebral. And spasms of the arteriogram. Treat with corticosteroids once again. Kawasaki disease. Asian children less than 4. Conjunctival injection or rash. Polymorphous desquamating. Adenopathy. Cervical. Strawberry tongue. Oral mucositis. Hand-foot changes. Edema. Arrhythma. And this is a D, so right here. Hand-foot changes. Crash and burn. Conjunctivitis, crash, rash, adenopathy, strawberry, hand-foot, and fever, burn. May develop coronary arteries, aneurysms, thrombosis, rupture can cause death. Treat with IVs, immunoglobulin, and aspirin. And here's E. There it is. What else? Borgwire disease, thrombolynginitis, obliterans, heavy smokers, males less than 40, intermittent claudication may lead to gangrene, auto amputation of digits. So here's your F. F is right here. So auto amputation of digits, Raynaud phenomena is often present. Segmental thrombosing vasculitis with vein and nerve involvement. Treat with smoking cessation. Don't smoke. There you go. All right. And then we have the upper respiratory tract. Granulomatosis with polyangiitis, called the Wegener syndrome. Low respiratory tract, hemoptysis, coughing, dyspnea, renal, hematuria, red cell casts. The triad. So here's a picture of it. Focal necrotizing vasculitis, necrotizing granulomas in the lung and upper airway, necrotizing glomerulonephritis, PR3, angioproteinase 3, large nodule densities, treat with cyclophosphamide, corticosteroids. Microscopic polyangiitis, that's H, that's right here. Necrotizing vasculitis, commonly involving lung, kidney, skin. Pauciimmune, glomerulonephritis, and palpable purpura. Presentation similar to granulomatosis with polyangiitis, but without nasopharyngeal involvement. No granulomas. Treat with cyclophosphamine and corticosteroids. Behçet syndrome, that's a popular one. High incidence in Turkish and Eastern Mediterranean descent. recurrent aphthous ulcers, genital ulcerations, uveitis erythema nodosum, also precipitated by HSV, herpes simplex virus, or parvovirus. Flares last 1 to 4 weeks. Immune complex vasculitis associated with HLA B51. So here's your G and your H, and then the I and J. Eosinophilic asthma, sinusitis, skin nodules, granulomatosis, necrotizing vasculitis with eosinophilia. Can also be involved with the heart, gastrointestinal, kidneys, immunoglobulin A vasculitis, and that's your J. Also known as HANOC, Scholin purpura. Most common childhood systemic vasculitis. Often follows URI, upper respiratory. Classic triad: skin, arthralgias, and gastrointestinal, abdominal pain. Vasculitis is secondary to IgA immune complex and associated with IgA nephropathy. Okay. And let's see, we've got one more. The cardiac tumors. These are most common heart tumor is a metastasis, melanoma. Primary cardiac tumor in adults. 90% occur in the atria, mostly the left atrium. Myxomas are usually described in a ball valve. Obstruction in the left atrium associated with multiple syncopal episodes may oscillate early diastolic tumor, plop sound. Histology. Gelatinous material, myxoma cells immersed in glycosaminoglycans. And then rhabdomyomas. These are most frequently the primary cardiac tumor in children, associated with tuberous sclerosis. And the histology would be the hemorrhagic growths. Last slide is the Kussmaul sign. Inspiration instead of normal, decrease. You have an increase in JVP. Inspiration, you have a negative intrathoracic pressure not transmitted to the heart. Impaired filling of the right ventricle. Blood backs up into the vena cava, and you get JVD. May also be seen with constrictive pericarditis, restrictive cardiomyopathies, right atrial and ventricular tremors. Hereditary hemorrhagic telangiectasia. Just as a side note, the JVD, as we said earlier, it's the jugular vein distension. If you ever see someone with a bulging neck vein, the jugular vein is visible. It's known as JVD. It's a sign of increased central venous pressure. So measurement of the pressure inside the vena cava. So hereditary hemorrhagic telangiectasia, boy, that's a tough one. Also known as Osler-Weber-Rendu syndrome. It's an inherited disorder of blood vessels. You'll have findings like blanching lesions on the skin, mucous membranes, recurrent epistaxia, skin discolorations, arteriovenous malformations, gastrointestinal bleeding, and hematuria. Hematuria, so blood in the urine. Osler-Weber-Rendu, inherited disorder.